kwepirinda nkukira okutambirwa kandi amagara ngakira amagana.
Hariho abandi abinanye ndagamba omushaho abakoza ekitweta traditional eye medicine ebishaka very dangerous.
Program manya amagara gawe ntukusyaho abashaho abakugu
HPV vaccine ekingira kanseri n'amanyinda 90%.
bakushomesa ebintu bitari bimwe na bimwe ebibwakubasa kukora kugira ngo oture amagara marungi.
It is very important tujahirwaro omanya amagara gawe exposure tukenezo mbazi nazo ne ARVs ozimira for 1 month abo kubaka aka virus kakatakaira omuseri y'omuntu tokafuna kamuka kataire mu wafuna HIV.
Ebyona ntubikora okufutaho empindahinduka omuka yawe n'omuhereza wawe twishe Nicholas aha GNTV.
This is GNTV, releasing life.
Welcome to our health show, Manya Amagaragawe, where we bring you the best of the best in health. We normally go and search for very many people who are doing medicines and the real doctors to come over here, and they always give us the message and good information about our health. Tonight we shall be talking about oral health. We understand that a healthy mouth is a healthy mind. You cannot be very good in the community if your mouth is smelly. Right now we have come with one of the passionate people in the mouth so that we can talk about this and we understand what we can give to you. Let us give him a chance to introduce himself, then we start off. Thank you for coming.
Thank you very much.
Yes.
Hello everybody, my name is Jeroen. I'm a dental student from Karolinska in Sweden. I'm in my 5th year and I'm here in Uganda for an exchange for 2 months.
Okay.
So it's a pleasure to be here.
Thank you very much. We would like you, Jerome, to tell us about what is oral health so important to our overall health.
Well, you can usually say that the mouth is a very good mirror of the general body health.
Yes.
Because people who take care of their oral health usually also take care of their general health. And there's many unhealthy habits that are reflected very clearly in the mouth. For example, if you eat a lot of sugar, you usually become fat, which is unhealthy, but you usually also get cavities. Okay. And if you smoke cigarettes, you can get periodontitis, which is tooth loss disease. But if you smoke cigarettes, you're usually also pretty unhealthy in the rest of your body.
Yes. What are those common dental problems people face today?
Well, the most common two are cavities and periodontitis, or tooth loss disease. Those are the biggest two. And they both kind of have different risk factors. Periodontitis is more smoking, but also not brushing adequately, and that also causes cavities. But eating a lot of sugar doesn't really cause tooth loss.
Yes, you have talked about brushing. How many times does a person is supposed to be brushing their teeth every day?
Well, the Swedish Dental Society recommends to brush twice a day, and when you brush for 2 minutes, and you use toothpaste.
Yes. Which kind of toothpaste?
Toothpaste with fluoride in it.
Yes.
So it doesn't really matter what brand, every brand like Colgate or Sensodyne or Zendium or whatever, they all say that their toothpaste is the best.
Yes.
And I mean, they're great at marketing, but the studies haven't really shown that. The most important part is that your toothpaste has fluoride in it.
Yes.
1450 parts per million for adults and 1150 for children under 6.
Yes. We normally find out that they are telling us that most of those toothpastes which contain fluoride, that it affects the brains. Is it true?
Well, you see, everything in a large enough dose is dangerous.
Yes.
But if you use fluoride toothpaste normally and you spit it out afterwards, the health benefits definitely outweigh the risks.
Okay.
The reason why children below 6 have a weaker toothpaste is because the effects of swallowing are less bad, because children can't really control if they swallow it or spit it out.
Yes.
But no, there has been no conclusive evidence that fluoride would cause a negative impact on a person's brain.
Yes.
But there has been study after study, proof after proof, that fluoride helps protect the teeth. And I don't know if you want me to explain the biochemistry of it all, but it's very clear evidence that fluoride toothpaste helps. So all these herbal toothpastes that you can buy that do not contain fluoride, you can use them if you want. It's a free country, but you need to be aware that you're causing yourself and your children a higher risk for cavities. And cavities is, a pretty serious issue, because if it grows big enough, then it eats into the pulp, and then your tooth dies, and then it needs to be extracted or get an RCT. And this is expensive, this is painful, and this is nothing you want to have your children experience.
Okay. How often should a person visit a dentist?
Well, that really does depend on the risk of the person.
Yes.
Say a person who gets a lot of cavities often, because cavities, they're not just because of lifestyle choices, like how often you eat sugar. It's also a bit of biology and luck. Some people have very good saliva, which protects their teeth very well, but some people, maybe people who have had cancer or people who have had Sjögren's syndrome, they don't really produce any saliva, so their risk is higher. But generally, every 2 years is a good idea to do a checkup, because in that time the dentist can catch a cavity before it becomes too big, and you can usually do a filling on it.
Yes. In Africa, we have a tendency of using charcoal to brush our teeth, and mostly that's how many people use that one. Is it recommended?
No, charcoal is not recommended. I would highly advise against it. Because the reason why people use charcoal toothpastes is because charcoal is kind of abrasive. It's like sandpaper. So what it does when you use charcoal toothpaste, it scrubs away the outer layer of the tooth, which, in the short term maybe makes the tooth a bit whiter, because it removes the outermost layer, which maybe contains a bit of pigments. But in the long run, if you use it enough, then you completely remove the outer layer. And the tooth is constructed in a way that it has an outer hard layer, which is white, and then a softer inner layer, which is yellow. So if you brush enough with charcoal toothpaste, you brush away the nice white layer completely, and then you only have the yellow part. And you also get tooth sensitivity, and you increase the risk for cavities, because this inner layer, it's weaker.
Now, you have talked out of the charcoal putting away the outer layer, and most people, they are recommended to do scaling. And the scaling also remove the outer layer.
No, I wouldn't say so. Well, in a certain sense, yes, but scaling isn't really for abrading away the outermost layer of enamel. It's about removing surface dirt. So let's say bacteria that collect in your mouth, they combine with the proteins in your saliva, and they sit on your teeth, and then you get something called dental plaque, and that's that white stuff that you can scrape off your teeth if you haven't brushed them in a while. If this plaque can sit on your teeth for a longer time, then calcium from your saliva reacts with it and causes something called calculus. And this is this hard tooth stone which sits on your teeth, and this is what's removed when you do a scaling. But you don't remove any part of the tooth. So it's more of a cleaning than that you remove the outer layer. If you want to have whiter teeth, there is other safer ways to do it. Let's see, sodium peroxide is something that your dentist could apply in a high concentration and have sit on your teeth for a little while. And that kind of goes in between the crystals of the tooth and removes the pigments, but it doesn't remove the outer layer of the tooth. So that would be the recommended treatment if you really want to have whiter teeth.
Which best method should someone be brushing their teeth and frosting their teeth?
When it comes to brushing, in Sweden we generally recommend the Bass method, that you have your toothbrush and you put it against the last tooth and you angle it 45 degrees towards the gum, and you apply very light pressure. You can use 2 fingers if you want, because if you press too hard, you risk, taking away the outermost layer.
Yes.
You don't want that.
Okay.
So in the end, you stay on one tooth and you do 2 seconds back and forth, and the next tooth, 2 seconds back and forth, 2 seconds back and forth, because dirt usually accumulates around the gums, and this is where it causes inflammation of the gums. So you need to make sure that you don't only do like the big part, you need to aim for the gum side, and you do that, and then you also brush on the biting part of the tooth.
How many minutes should you be taking all the mouth? Brush it the whole of it.
2 minutes for
minutes.
the whole mouth.
Okay.
And when you use floss, you go in between the tooth, and then you press against one tooth, and you go down slightly under the gum, and you go back and forth 5 times, and then you go against the other tooth, slightly below the gum, back and forth 5 times.
Okay. How does that affect our dental health?
Diet affects dental health in 2 big ways.
Yes.
First of all is what kind of food you eat, and second of all is how often you eat.
Okay.
So first of all, in what you eat, cavities are caused by the bacteria eating short carbohydrate chains, so sugars. So if you eat sugar, then these bacteria, they eat the sugar, and then they excrete lactic acid. And this lactic acid is what dissolves the tooth and causes a cavity. So if you eat a lot of sugars, then you get cavities. So candies, sweet daddies, sodas like cola or Novida. So these things are usually recommended to keep to a minimum.
Okay.
I know this is a big ask for the audience, but we usually recommend you can only eat sugar once every week, maybe on Saturday morning. But if you have tea in your sugar, tea in your coffee, sugar in your tea, sugar in your coffee, sugar in your cereal in the morning, then that's not good.
Okay.
And second of all, like I said, food frequency. You should not eat more than 3 or 4 times in a day, because the teeth, they need time to rest in between the meals. Because otherwise these bacteria, they will be eating all day, and then the risk for cavities is bigger. So you can eat breakfast, lunch, maybe a snack, and then dinner. But if you eat all the time, you know, there's a lot of people who sit and they study and they have a bag of candy or a bag of chips or some cookies, and they eat once every 10 minutes. That's when you get cavities.
Okay. What are some of the misconceptions people have about oral health that you can encounter, Oris?
Let me think. It kind of depends. In Sweden, like herbal medicine and alternative medicine are very uncommon. So when you meet people who think that fluoride toothpaste is dangerous, it's not something common for me. But if I understood correctly, in Uganda, this is a bit more common appearance. So I think that's a big one, and I don't really understand why. I know now in America they're talking a lot about how fluoride is dangerous, and you know how fluoride is a toxin, and everything is a toxin in high enough doses. But what we're using in toothpaste is sodium fluoride, which is the ionized version of it, which is a lot safer than fluoride gas, which is toxic. But you know, let's see, sodium, potassium, you know, it's something that you really need. It's very important. It's in bananas. So people say potassium is healthy, but if you have a pure piece of potassium, you know, it's explosive and it will kill you. So you need to put everything in perspective and not be scared that something can be dangerous. But some other misconceptions is maybe that you don't need to brush your teeth in the morning, because I haven't eaten anything anyways. But that's not true. It's very important to brush them, because during the night bacteria still accumulate in your mouth. So it's not the food that we're brushing away per se, it's the bacteria. And also you need to have this protective layer of fluoride in your mouth during the day. So people who have a lot of cavities, we usually recommend to use maybe some fluoride varnish in the middle of the day to have a good concentration of fluoride in the oral cavity.
Yes. We would like you to tell us some of the cavities which people normally experience.
There is only one type of cavity. It's the bacteria. They eat the sugars and the food that you eat, and then they start dissolving the tooth and going into the tooth. And you have an initial cavity, which is a small cavity, which is only in the outer harder layer. And when it is this small, it doesn't need to be repaired. If you just change your dietary habits, the cavity will stop growing. And if you change them back into bad habits again, this cavity will easily reactivate. But if you just keep healthy, then this cavity is safe. Then you have a bigger lesion, which goes into the inner softer layer. And when it's in this stage, then you can't stop it anymore by changing your diets, because the bacteria is already in the tooth, so it will just keep growing. And then when it ends, it goes into the pulp, because the tooth has outer hard layer and inner softer layer, and in the middle there is some nerves and some blood vessels. And when the bacteria go into the nerves and the blood vessels, that's when it really starts hurting, because it's bacteria, on your nerves.
Yes. What can people do to stop the cavities and the gum disease?
Well, it's mainly about lifestyle habits. Like I said, what you eat, how much sugars you eat, how much sugars you drink. That's something you should reduce as much as you can. Food intake frequency, how often you eat. This should be no more than 3 or 4 times a day. And also when it comes to gum disease, to not smoke cigarettes is very important. And those are the biggest things.
How does, you have talked about smoking, how does smoking and tobacco affect the oral health of these people who use them?
Well, cigarettes, they contain a lot of toxic substances, tars, and when you take them in, they have a toxic effect on the soft tissue when you blow them in between your teeth. Just like they have a toxic effect on your lungs and on your heart and on all your organs. Smoking is very evidently connected between so many diseases. It is very toxic. So, but I think smokers are aware of this, but they still do it because it's an addiction. But I implore the people who smoke to give it a second thought. And I know when you smoke, your gums aren't your priority. Maybe you should listen more to your doctor who says that you're going to get lung cancer or cardiovascular disease. But gum disease is a very big part of smoking, the problem. And also, something specifically with smoking is the heat. Because when you inhale, you get very hot air that goes in between your teeth. And this air, it kind of, it kills off parts of the gum, and it reduces the blood vessels, and this decreases the power of the body to fight these bacteria in the gum, so it makes it more potent.
It's for eating to give a good health to our teeth.
Well, generally just normal food that doesn't contain sugar, so like the normal food like matoke and meat and some vegetables. They usually don't really cause any harm. But foods that are also hard to chew is good, because it kind of cleans the teeth in a way. Because so like eating a carrot is good.
Okay. Let us go for a short commercial break, then we come up as we're wrapping.
This is GNTV, releasing life.
Omulungi na kwakira omululo gundi on program yawe manya amagara gawe amazina niraga ntichi Nicholas. Tuyo mchuka cha kabiri omuchweka cy'ukubanza wareba omushaho kukuyana kushobora ingeri yo kubasa ku brushing amamino gawe, kandi n'ingeri yo kubasa kumanya nimirundi ngahi ningashi nibwireki obosheme kuba notwara obu ku brushinga amina gawe. Ogo yabali Dr. Jero okuruga omuri Sweden haza ali omu Uganda obwa hatiya. tuliontuza omuchweka ekyakabiri tulabe ntufunawo profesa okuruga omuli USA ogwenaza kubali Professor Heather Taylor omukugu omumino ningasho tukubasa kumanyanka dental hygienist so kubantu mwachira aha GNTV abena tugambira ebyabena tugambira haza tugukoreje tubimanye tugumize mu na program. Yes, right now we shall be receiving Professor Heather Taylor, who is in United States. She's going to be talking about more about our dental health. She's a dental hygienist. We shall be talking to her in different questioning, and she will be giving us more about from what we have been having. Yes, Professor Heather, you're welcome on GNTV tonight. We have been before, we are talking about the dental hygiene, and you're one of the people in this world who are known to be dental hygienists. You're welcome.
Thank you so much for having me. I'm so excited to be here.
As we're starting, Doctor, I wanted to know about, it is very great for most of the things you always teach, and we would like to know more about how someone can do thorough frosting and brushing. You can explain to us.
Everyone has bacteria, both good and bad, right? We have about 700 different bacteria. It's called our oral microbiome. And there is a direct link between our mouth and our gut. And if you think about it, our mouth is where true health starts. There is not a magic fence that stops the bacteria from your mouth from getting into the rest of your body. So if you have a disease in your mouth, you have systemic disease. And guess what? Over 80% of Americans have some form of gingivitis. That's an infection in your mouth. It's not okay that your gums are bleeding. That's not normal, right? Your gums should never bleed. You should not have a bad taste or odor in your mouth. You need to be going to the dentist to be getting your teeth cleaned. You have to be brushing your teeth at least twice a day. And you have to floss the teeth that you want to keep, because brushing alone is only going to remove maybe 60% of that bacterium. So what happens when you use these commercial mouthwashes and everything is they actually disrupt that oral microbiome that you have because it's very acidic. People don't realize that in order for you to get a cavity, your saliva has to drop below a 5.5. So when you use, say, Listerine, the pH of that is 4.2. So you're swishing with acid, you're disrupting that oral microbiome, you are making your mouth more acidic, you can create more of a environment for decay. All of this is not natural, right? Because your saliva is your natural protectant. So then what happens is that kind of makes those bad bugs start to thrive in there. When you have an overabundance of the bad bacteria in your oral microbiome, that's how you get bacterial infections, periodontal disease. And a lot of people don't understand the difference between gingivitis and periodontal disease. Gingivitis is an inflammation of the gums, but your bone is healthy. So your teeth are sitting here in your jawbone. And if your gums get inflamed, that's gingivitis. But leave that in your mouth long enough and your bone can actually be rotting away. That's periodontal disease. Okay, so the difference is bone loss. Once you start to lose your bone, honestly, it's really a struggle for the rest of your life to keep your teeth. And so we want to figure out what's going on in that oral microbiome. Like, do you have a bacterial infection? Perhaps do you have what's called an MTHFR mutation, which is where your body does not detoxify properly because you can't produce the methylfolate that your body needs to help your body heal. So that can be an underlying cause of periodontal disease. Sometimes people have, believe it or not, these vegan diets or too many vegetables can create an oxalate toxicity. That means that your body is now having inflammation in the gum tissue, believe it or not. But it's just so amazing what the mouth shows you. They look at animals' mouth because this is really where you're going to see things from the rest of our body and completely ignore it and think, yeah, I brush my teeth once a day, I'm good, but never go to the dentist, never floss, don't do any of those things. And then you end up having periodontal disease. And now you're like, oh my goodness, what do I do now? So I really want people to understand that prevention is key. If you had a vehicle and you never took your car in to get an oil change, you can't be mad at the mechanic when you blow that engine. No, it's so many thousands of dollars to fix that engine. So you need to be getting your teeth cleaned frequently. you definitely need to be finding out what the root cause of your issue is, whether you are lacking vitamins, whether you or not you've got a bacterial infection, which, by the way, I'm not too all over the place here because there's so much information, but getting back to that oral microbiome, we can now do diagnostic testing with a saliva test. So we can sample a few areas in the mouth and send that off to the lab. And then the lab lets us know as providers, okay, out of the 11 bacteria that cause that bacterial infection, you might have 1, you might have 2, you might have all 11. But what's so awesome is we can now see if you've got the marker for Alzheimer's, for colorectal cancer, pancreatic cancer, heart attack, strokes, diabetes, all from the bacteria in your mouth. And it's a simple saliva test. So I think more and more dental providers are becoming aware of the technology, but there's always some pushback from people saying, oh, well, that's not necessary. No one has ever mentioned this to me before, but it's new technology. And if you had a marker for Alzheimer's, don't you want to know about it? I know I sure do.
Thank you very much, Doctor, for the great information you have given us on how to floss and everything, on how you can take your dental care.
I'm just going to tell you this little saying, and it's probably going to gross some people out, okay? But not flossing is like wiping your butt cheeks, but not your crack. Think about it the same way. But brushing is just the smooth surfaces. You have to go underneath the gum tissue to remove that poop, that biofilm underneath there. And 40% of the bacteria in our mouth can clog our arteries.
But doctor, we would like to know, what are some of the misconceptions some people talk about cavities, and what are the causes of the cavities that we should be knowing and understanding?
You actually reduce your biological age by 7 years because you're keeping your arteries cleaner and healthier just from the bacteria in the mouth. So we need to stop thinking about it as just your teeth. Your teeth are alive. They are linked to organs in your body. So again, if you've got an infection in your mouth, you're going to have a systemic infection. So things that we can determine as providers are very easy to do. When you come into my dental chair, some of the things that we do right away is we take our little ruler, basically, and we measure the space between your tooth and your gum. So a healthy space, a healthy pocket would be like 1, 2, or 3 millimeters in depth. If you start to get 4s, that's really a sign of gingivitis. If you start to get 5s, that's a sign of early periodontal disease. 6s, 7s, the worse that it gets. But you want to catch something sooner rather than later. I always tell people, when do you want to find cancer? Do you want to find it at stage 1 or do you want to wait till stage 4? Same thing with gum disease. It's not just going to magically get better. If you have an underlying root cause and you don't address it, it's going to come back. And that's why I think doing the bacteria culture is so important, because it's a missing link. There are certain bacteria that are resistant to doing a deep cleaning. So we can do a deep cleaning and then you can come back and it might get a little bit better, but then over time, because your oral microbiome changes every 80 to 90 days, those acids are going to start to build up again, and you're going to start to have the disease process kick in unless you address the root cause. So getting to the root cause is so important. And like I said, finding out if you have perhaps a mutation where your body isn't detoxing properly, a bacterial infection, or perhaps an oxalate issue with what's going on with your kidneys. So finding out the root cause is so important because, long term, you want to be able to keep your teeth. We can amputate teeth. We can make people prosthetics, but it is never the same thing, just like an amputated limb. If you end up in dentures, your chewing force is reduced by at least 30%. You don't talk the same. You don't look the same. It's a whole other set of problems. You've seen people without their teeth, like their whole face things in. It's not a very good option. You don't want to just pull all your teeth. And again, that is connected to your overall body. So you want to be able to keep your teeth and you want them to be healthy. So certain things that you can do, again, make sure you're getting your teeth cleaned professionally at 2, 3 times, sometimes 4 times a year. Because like I said, our teeth poop every single day. The main thing is for the home care. You have to have a really good electric toothbrush. In fact, if you go on my website, I have a 40% discount code that you can use on a great electric toothbrush, has a lifetime guarantee, $69. But I think with the coupon, it's like $49. So no excuse for that. A water pick is super, super important because that way it really helps to flush bacteria out from underneath the gum. You want to use products that are chemical free because again, think about promoting good salivary flow, a healthy oral microbiome, things that aren't acidic, actually help raise the pH of your mouth. So of course, I'm going to recommend Simply Silver products. But if you have the right aids at home, it's very, very important. But also most people don't do it properly. The number one mistake people make is that I don't even think I have any around here, but those little floss picks, I call them cheaters. Throw those suckers away. All they do is they transfer bacteria from one part of your mouth to the next. They don't go underneath the gum. And the whole purpose of flossing is to clean that space that I mentioned earlier. You have to hug the tooth and you got to go all the way down or you're not flossing. Popping it in there is not doing you any good. So if you use the right products, do that properly, that's great. But we do need to look at the mouth as the whole picture. And diet is the most important thing. And as you know, Desiree, I mean, Americans have such a horrible diet, honestly. High processed foods, things that are super sugary, that are creating this acidic environment inside their mouth. That's perfect storm for decay and disease. So what you put into your body is obviously super important. Yeah, you're exercising your gums. And I would tell people too, don't be alarmed if it hurts or it's bleeding at first. Give it 3 days and your gums, because your mouth is the most vascular part of your whole body, does start to heal. Now that isn't to say that you're going to just magically make that go away. You're going to have to go to the dentist. You're going to need to get your teeth professionally cleaned. You're going to need to see where you're at, diagnostically, but don't be afraid to floss underneath the gum tissue. Now, I will say if your pockets are deeper than 4, floss is not going to access that deep pocket. That's why you need to have a water pick, because the water pick is going to help to flush out that bacteria. And what we want to do is when you have a deep pocket, right, you've got all this space open where bacteria is just packing underneath there. We want to close that space because the tighter that gum is against that tooth, that means it's tight, it's shallow, it's firm. That's where we want to get that pocket. We want to have a healthy 1, 2, or 3. We don't want this open, wound basically where you're just able to stick that ruler all the way down in there. That's massive infection, right? So we want that space to close. And you can do that, like I said, with home care, with using the right aids. An electric toothbrush is really a must. I see so many times people use their manual toothbrushes as like a weapon. It's like zombie brushing and you scrub too hard. It's not how hard you brush your teeth. It's the length of time that you spend brushing, but you got to do it correctly. You got to angle the bristles down into that gum. You hold it there 5 to 10 seconds, and then you pick it up and move it. And then you pick it up and move it. You don't need to be doing these, long strokes back and forth and really damaging your teeth and your gums. But a lot of times I think there was more of a belief that you were brushing your gums away, which you can do, but now they are understanding the importance of airway. And if you're not breathing properly, you actually have a closed airway that can create recession. And if your bite, which, your teeth need to come together properly, if you're hitting your teeth edge to edge, this is trauma. Okay. This is a traumatic bite, and that is going to create bone loss. It can create TMJ problems, all kinds of issues because you're not having a proper alignment of teeth. So there's things that they can do now with Invisalign, which is clear aligner therapy, getting the teeth into a good position so that they're not traumatically occluding and creating these issues. So we want to look at the whole picture. It's not just the brushing, the flossing. It's like looking at everything. It's looking at your airway. It's looking at underlying causes, what your home care is. But there's so many things that we really need to think about and not just kind of put on a shelf, because unfortunately 100 million Americans don't go to the dentist every year, nor do they brush their teeth even twice a day. And that's really tragic. We live in the US. We should be able to put more of a priority on that and not allow dental insurance to dictate. People are like, oh, I just want my free cleaning. Well, let me just explain something to you. Okay. If your free cleaning from your insurance company is called a prophylactic cleaning. That means you have a healthy mouth. How many Americans have a real healthy mouth? Not too many. I'm going to tell you that right now. So then it's a different type of cleaning. Okay, either a gingivitis cleaning, or if there is bone loss, now we're looking at a scaling and root cleaning, like a deep cleaning. So it just gets more and more expensive. Neglect is expensive. Prevention is easy. So I want people to maybe start to change their mindset on stop thinking about how much that is going to cost you and think about long term. It's going to cost you so much more if you don't do something about it sooner rather than later.
Thank you very much, Doctor, for the great information you have shared with us there in USA and telling us more, we Ugandans, on how we can take care of our teeth and how we can be good dental hygienists like you. We thank you very much for the information and the real management you for real at the time, the conversation you're giving us today.
And I wish people would not wait for something to hurt, because I think there's this misconception that if you have a cavity, it hurts. Cavities don't hurt until it gets into the nerve of the tooth. Your enamel has no feeling. So you can have decay in your enamel and not know it. It's not going to be until it hits the nerve of the tooth. So instead of it being, say, a $300 filling, you're looking at a $3,000 problem for one tooth because you waited. And the same thing with gum disease. Like, you're never going to feel that, your bone is rotting because your bone has no nerves. But the signs and symptoms are going to be the bleeding, either when you brush or floss, sometimes a bad taste or odor in your mouth, sometimes even feeling like your teeth are loose. Those are all signs of, massive disease. You don't want to wait. Okay. You want to catch that early. That's stage one that I'm trying to get people to go to the dentist and take action now. Right. And there's different things that you can do to remineralize your teeth. Again, you want to be giving your body what it needs, because your teeth are the windows to your bones. So vitamin D supplementation is so important. And I wish someone had told me in my 20s that you only have until you hit menopause to be building your bone, because hormones affect everything, right? So you want to be building your bone with good vitamin D. You can use things like Kerrygold butter. It's loaded with minerals from grass-fed cows. So that's fantastic as well. So you want to make sure that you're getting the right nutrients into your body. Oh, you don't need fluoride. Okay. Fluoride is honestly, it's a labeled poison. And if you look at the back of a toothpaste, commercial toothpaste, it says drug, right? Because it's a labeled drug. And there's a poison label on there. Harmful to swallow, contact poison control. You don't need fluoride. If you get a cavity, it's not from lack of fluoride, folks. Okay. You're being inundated with fluoride. It's in your water. It's in everything. So it's not from lack of fluoride. There's an imbalance in your oral microbiome. There's an imbalance in your saliva. There's an imbalance in your diet. Maybe you're breathing through your mouth. Okay. Breathing through your mouth, dry mouth, creates cavities faster than anything else. It can give you rampant decay from breathing through your mouth. And sometimes medications can really dry mouth out too. So you want to really watch that. You can do things like mouth tape. There's like a little crisscross sticker that you can put on your lips at night. If you feel like you're breathing through your mouth at night, you can do that. Very simple fix, like $10 on Amazon. There's basic bites. There's lozenges that you can use to help keep your mouth moist. But there's a product now called nanohydroxyapatite that NASA actually created for their astronauts. When they would go out into space, they would lose bone density and everything. Your teeth are 90% hydroxyapatite crystals. So nanohydroxyapatite is bioidentical to the actual makeup of your teeth. Absolutely. And you can do things like xylitol. Xylitol is a sugar that plaque does not eat. So you can do xylitol-based gum. Anything with xylitol in it is going to be super healthy for your mouth. So that is a natural sugar that I just absolutely love. It helps raise the pH of your mouth, moistens the mouth. So again, that's in a lot of my products as well, because it's just got so many benefits. But another trick too is, I would say, for people trying to get in the habit of flossing, is maybe keep the floss in the shower. I feel like that's a good point for it, It's not out of sight, out of mind. Maybe while you got conditioner in your hair, wash your teeth. Or a lot of times what happens is people are just so tired at the end of the night. They just, don't want to do one more thing. After you eat dinner, go and do all that. So it's done. And then, if you crash out, you've already done it for the night. Just try and find a designated time that works for you, that you can invest in your own self-care, because that's really what it has to be. It has to be self-care.
Thank you very much, Doctor. Once again, I would like to thank you for the great knowledge, the time you have shared with us, and the information you have given us towards all this. And we promise that each and every viewer of GNTV and everyone who is watching on every platform this program, we shall put everything in practice and make sure that our dental health, it is very nice, as we can contribute to the smiling faces of this world. You know, when you have a very good dental hygiene, you can be everywhere, and you know the first face you could see is your dental on each and every human being. Thank you very much. As we are ending, your viewers, we would like to tell you that everything the doctor has told us, let us put it into practice so that we can make the best of our dental health. This program is already there every Tuesday from 10 a.m. to 11 p.m. and every Thursday from 10 p.m. to 11 p.m. Remain on GNTV as me, your programmer, Richard Nicholas. We shall always bring you all these people, and we are making our programs the best.